Hi guys, we are discussing inhalatory anesthetic. One of them is Halothane. Let's start doing this. Halothane have interesting structure as you see 2-bromo, 2-chloro and 3-fluoroethane. It is a colorless liquid with a relatively pleasant smell. It is decomposed by light. Also, it is decomposed by soda lime. It may be used safely with this mixture. It corrodes metals in vaporizers and bracing systems. In the presence of moisture, it corrodes aluminum, tin, lead, magnesium, and alloys. So it should be stored in closed containers, always from away from light and heat. The addition of 0.01% thymol and storage in amber-colored bottles renders it stable. Halothane has a blood gas solubility coefficient of 2.5, which is the highest of all the modern agents. What means blood gas solubility coefficient? For example, these ones are particles from gas and this one is blood vessel. If blood gas partition or coefficient is high, it means that it going fast to the blood and equalize with blood. If it is low, it crosses through the blood vessel very slowly. Okay, Halothane, it is not irritant to the airway, and therefore inhalational induction with Halothane is relatively fast compared with other desflurane or isoflurane. However, it may take at least 30 minutes for the alveolar inspired concentration to reach 50% of inspired concentration. Induction of anesthesia is rapid and can be achieved by using 1 to 3% of Halothane in air or oxygen. So mixturing with air or oxygen, or by using 0.8 Halothane in 65% nitrous oxide. Recovery from Halothane anesthesia is slower than with other agents, so slow recovery, because of its high blood gas solubility, and recovery is prolonged. So after Halothane is going to the blood and reaching brain, it comes back and it still predominate in the blood and not outside, or for example in alveoli. So its elimination is slow and increasing duration of the anesthesia, of course. So 20% of Halothane is metabolized in the liver and the end products are excreted in the urine. Major metabolites are bromine, chlorine, trifluoroacetic acid, trifluoroacetyl acetylethanol amide. So a small proportion of Halothane may undergo reductive metabolism, particularly in the presence of hypoxemia. So if patient is ventilated badly, and when the hepatic microsomal enzymes have been stimulated by enzyme induction agents such as phenobarbital. So P450 induction also have the weight in this process. Let's discuss every system and how they undergo changes by Halothane induction. Respiratory system, Halothane is non-irritant, pleasant to breathe, and during induction of anesthesia it is used. There is a rapid loss of pharyngeal and laryngeal reflexes and inhibition of salivary and bronchial secretions, so decreased secretions. In the unpremedicated subject, Halothane anesthesia is associated with an increase in ventilatory rate and reduction in tidal volume, increasing ventilatory rate and reduction in tidal volume. So Halothane also could cause dose-dependent decrease in mucociliary function, which can persist for several hours after anesthesia. This may contribute to post-operative sputum retention, and Halothane also antagonizes bronchospasm and reduces airway resistance. So asthma patients are welcome for using Halothane. Let's go with other systems, cardiovascular system. Halothane is a potent depressant of myocardial contractility and myocardial metabolic activity as a result of inhibition of glucose uptake by myocardial cells. During controlled ventilation, Halothane anesthesia is associated with dose-related suppression of cardiac output with little effect of peripheral resistance. So decreased contractility, decreased metabolic activity, and also could be associated with bradycardia. Arrhythmias are very common. Halothane anesthesia is associated with arrhythmias and far more frequent than with other agents. Central nervous system affection Halothane produces anesthesia without analgesia, so you should add some analgesic opioid, for example. And also cerebral blood flow and intracranial pressure rises. So it produces vasodilation and increased flow to the brain. It does not cause seizure activity on electroencephalogram, no seizure activity. How about gastrointestinal tract? Gastrointestinal motility is inhibited. Postoperative nausea and vomiting are seldom severe. So no motility, it coming back and producing symptoms like nausea and vomiting. Halothane relaxes uterus and can cause postpartum hemorrhage. It is good that relaxes uterus, but if you need contractions, you can add some oxytocin. It is says that concentration of less than 0.5% is not associated with increased blood loss in C-section. How about skeletal muscle? So causes skeletal muscle relaxation and potentiates non-depolarizing relaxants. And postoperative shivering is common as it increases oxygen requirements and results in hypoxemia unless oxygen is administered. So be careful with this and give some oxygen for patient to prevent this undesired effect. Halothane may trigger malignant hyperthermia as other inhalatory anesthetics and succinylcholine. And you should suspect in patient malignant hyperthermia if you are using inhalatory anesthetics. And of course, one of the effects that is not indicated here, hepatotoxicity. The incidence of Halothane hepatotoxicity in pediatric practice is extremely low, but also there have been a case report in children. Nevertheless, Halothane is still used in pediatric practice. The incidence of Halothane hepatitis is low, so fulminant hepatitis low. What you should be taking care about Halothane. A careful anesthetic history should be taken to determine previous exposure, and any previous reaction to the drug used. Repeated exposure to Halothane within a period of 3 months, less than 3 months, anesthesia, and next one should be taken with with care. So there are overriding chemical circumstances, a history of unexplained jaundice or pyrexia. If you have a patient with history of jaundice, you should suspect some liver function test abnormalities and pyrexia, suspicion for malignant hyperthermia. After previous exposure to halothane is absolute contraindication to its future use in that patient. What are the advantages and disadvantages of using this? So smooth induction, minimal stimulation of salivary and bronchial secretions, bronchodilation. Disadvantages are arrhythmias, possible liver toxicity, especially with repeated administrations, and slow recovery compared with newer agents. Thank you for your watching. Hope this is helpful for you and have a good time, guys.